Can I just have a conversation with you about why you feel like you don't have to wear a mask?
I honestly don't. I just totally forgot it. I'm on my way to work, so I do support it. I do normally wear it.
Hi. Can I ask you why you're not wearing a mask if it's the law to do so?
Yes, I'm working in car, sorry.
Hi. Do you mind me asking why you're not wearing a mask?
I work in the hospital, I just need to get lunch quickly.
You work in the hospital and you're not wearing a mask?
Yeah.
How can you work in a hospital and walk into a shop and break the law and you know what this virus does?
That's alright.
What do you mean that's alright? How can you do that? Look at all those old people standing there with a mask on. We're just wondering about mask wearing. It's not really a laughing matter, sir, is it? Is there any reason why you're not wearing a mask?
It didn't occur to me at the time.
It didn't occur to you? With the thousands of people in the UK dying, it didn't occur to you?
Yeah,
And it's in your pocket? You're asthmatic, are you? And you think it's funny, do you? The people dying, is that funny? You know? When I've said to the authorities they're laughing at us, they are literally laughing at us. We just noticed when you walked in you weren't wearing a mask. But why is that, sir? Do you care? Do you care? So why did you go in without it? Like, I'm just asking. But it is the law, sir, so we're just asking. But I'm just asking why, if it's the law. Does it matter to you that people die from this? Why did you not wear a mask and into a shop where hundreds of people will go in after you? Is there no way you're going to talk to us now? Do you not care? So that's a guy just walks in, sorry? Just walks in, no mask, away he goes. We're just trying to chat to people about not wearing masks. Sorry? No, I know you're all right, but somebody who you infect might not be. Why are you not wearing a mask, sir? Sorry?
I don't need to wear one when we get in the van.
You don't need to wear one when you're in a shop with lots of other people?
I'm not being filmed either, so you can turn it off.
You are being filmed. You're being filmed now.
I don't want it to be filmed.
Well, we
It's
can
against-
still
it's
talk
against
to you.
my rights.
What about the rights of people who get sick?
Well, it's against my rights you filming me now.
Are you prepared to comment on your responsibility to the wider community of not spreading a deadly virus?
That's my opinion now, isn't it?
It is a lawful requirement.
And that's been done through the High Courts, has it?
Correct. That's been passed by
I've
Stormont.
not heard of that, I'm afraid.
But would you not want to anyway?
I don't have to answer that.
Just wondering why you didn't wear a mask into the shop. Then you wear one for effect for the camera after you've potentially spread a virus around a shop. Like, does it not matter? What's it to me? I'm a citizen in this country wanting protection from people like you. The PSNI are telling us there's a 90% compliance rate, and we are here openly, so openly with cameras. So we're actually standing at the front door and people still walking in full glare of the cameras without a mask. Have we lost control?
I really had to bite my tongue at that video there. How cringy. Anyway, what's happening everyone? This is D from NI Truth Seeker. I'd advise you to grab a cup of coffee because this one's going to be a long one. The video that we're going to be reviewing today is from Nolan Live. It was recorded on the 7th of October 2020. Nolan is at it again. In this video I want the public's opinion. As you can see, Nolan is physically chasing and harassing people in a garage forecourt. I want to know what gives him the right to do so. Keep in mind that Nolan is not a police officer or a doctor. As far as I'm aware, Nolan has no right to be asking such personal questions. Let me know what you think in the comments below. Let's begin.
This is not about the establishment. This is not about government responsibility. This is about you and I. You know, why are football teams in this country? Why are sports clubs in this country? Why are organisations, big brand organisations, not getting behind some type of initiative where they are going to try to get as much enforcement of social distancing and face mask wearing as possible?
No clubs will get behind something that will take out their team. Conflict of interest for the club. And there is now you virtue signalling that they are a bad, evil club because they don't support you and your fake numbers and pseudoscience, which we'll see later in the video.
Right? Why can't we do this together? Why is it always this thing about the establishment want it, so we're not going to do it? Alden, you told me tonight about a study involving animals with masks. Can you talk me through? This blew my mind. Talk me through what it is.
So this particular experiment
Let's listen to the experts here. He clearly has some important evidence to show us.
is where there was a cage of animals that were infected, right? These are hamsters, if I remember correctly. They were infected with the virus. And they were then separated from another group of animals that weren't infected. Okay, so one group of animals in the second cage weren't infected, and they were separated either with a mask or without a mask, right? The ones where there was no mask, 66% of the uninfected animals became infected. So in other words, the virus was transmitting through the air from the infected animals into the cage that had the uninfected animals. As soon as there was a mask put between the cages, that was reduced to 25% of the animals became infected. And not only that, but the severity of the disease was also diminished in those animals that were in the cage that was protected by the mask. So it's very significant the effect that the masks have in the transmission of the virus. It's not absolute, it doesn't completely prevent, but it significantly reduces the capacity of the virus to transmit from one person to another.
So let's just change that now from animals to imagining ourselves in a shop, and we're all, you're in the shop with your family. I'm there, right? I'm there. I'm an obese guy, right? So I'm there, and there's an elderly person there, there's a pensioner there, and there's a couple of other young people there too. And you're the guy or girl walking in there and you don't have a mask on because you don't care. By the way, if you have a medical condition, you have every right to not wear a mask.
What was that you said, Stephen?
You're asthmatic, are you? And you think it's funny, do you? Do people dying? Is that funny? You know?
So, there you go. Someone clearly said that they were asthmatic, but yet you proceeded to go on to harass them and say that do you find this funny? That guy should take you to court.
But you don't care, right? And you think about that animal study and then bring it into human beings, that you are reducing the risk from what, 66% to 25%?
25% in that particular experiment.
Science.
Good, Nolan. I'm glad you agree that we should listen to the scientists. Keep that in mind as we watch this video.
But there are numerous human observations as well. There was a case in Georgia where 2 hairdressers were infected with the SARS-CoV-2, and they wore masks. None of their clients became infected.
I refuse to believe that during this pandemic they let hairdressers who had the virus work with clients with a face mask on and the client did not catch the virus. Are you fucking serious? No one could get their hair cut during the lockdown. Sure, they were shutting every hairdressers and barbers and closing businesses, even handing out fines for the people trying to save their own business. And then you have this guy telling you that hairdressers are active, and furthermore, he is now trying to use this evidence of wearing face coverings. You're fucking mental. I just can't believe it.
There's an outbreak you probably heard about it, the USS Theodore Roosevelt, the aircraft carrier. Large number of the sailors became infected, and there was a clear evidence of reduced infection in the crew members that wore masks compared to the crew members who did not. So there's also evidence, anecdotal as it is, but there's also evidence with humans in clear situations demonstrating the efficacy of masks.
As you can see, he just admitted it's anecdotal. It's a story, not evidence. I digress. Moving on.
You can see if you can feel a tension in me tonight. Can I tell you what it is? It's those people who are accusing me of being part of the establishment and enforcing their message. I can tell you I've spent my career challenging that executive up there, but I'll tell you who I'm not going to just completely dismiss: the scientists, the doctors around the world that are telling you that this will help protect your own community. Now,
whoa, Stephen, hold your fucking horses there. As for you being part of the establishment, that's already been established. Who is it that pays your wage? The BBC? Sure, we'll say no more on that one. As for dismissing the scientists and doctors, I'm glad you agree. I want you to keep that in mind as we continue.
our lines are open tonight. We're live on BBC One. Sam's our first call of the night. Sean, sorry. Hello, Sean.
Hello, mate. How are you doing?
Okay, let's see what Sean has to say.
Go ahead, Sean. Thanks for calling us.
Can you tell me why shops are not getting fined? Why are shops not getting on the spot fined if they're letting people in without masks? Why
Well-
is it always down to the shopper?
Well, because
Why isn't the shops getting fined? I've never known a shop get fined yet.
Well, the reason they're not getting fined is because Stormont, our legislators, have not created the legislation to put the responsibility onto the retail sector. They have created legislation to put it onto the retail sector. If you go in and you're underage and you try to buy a bottle of vodka, if you go in and you're smoking, it's the shop's responsibility. If you go into a shop and you trip up on a mat, it's their responsibility. But if you go in with COVID and you don't have a mask on, it ain't their responsibility. Up until Friday, we had our chief constable telling us that there was a 90% compliance rate in this country of wearing a mask. And when the Nolan show went to them and said, where have you got that from? They didn't have any robust study to follow it up whatsoever. None.
Yeah.
So we've got to get real about this. And the health minister said tonight he wants the police to get involved. So let's see if they do. He wants environmental health officers on the ground. Let's see if that happens.
But they've got security guards in the shop are just letting them go in without a mask on. What's the point in having security? What's the point in having security on it in the shop?
Let me answer that there for you, Sean. It's very simple. No one has the right to tell another person what to do, as there's no legislation, and even then, it would only be a constable of the law. This tells you, Sean, there's no law, and you're an idiot. Moving on.
If they're not going to tell them to come in without a mask. They have security on the door and they let them in without the masks. Now, what is the point?
Let me bring in Roger Pollan tonight. Roger, thank you for joining us. You represent a significant business organisation in Northern Ireland, some 15,000 odd members in it, Roger. And the Health Minister, Robin Swann, in that interview with me tonight, has literally, he used the word seeing the business community step up now. So are you prepared to?
I thought at this point I'd point out that this guy's head looks like a cue ball wearing a black bra. But anyway.
Well, Stephen, you really deal in facts, so let me just correct one. We've 6,000 members in Northern Ireland, who between them own up to about 15,000 businesses, so 6,000 members in the FSB. But I think you made the point about pitting yourself against the establishment or not. But let me put it this way. There are more people in Northern Ireland who work in small businesses than in all large businesses and the entire public sector combined. So the economy belongs to all of us. We need to protect it. This is about the establishment trying to do something. Everybody watching the show tonight knows somebody has a family member who works in a small business. So
this is what it's all about. It's the small businesses that are being affected. The government don't want people making their own money and doing their own thing. They want people to be dependent and in debt. Just think about how long this is going to take to pay off. Your children's children will be paying for this. Let that sink in while we move on.
It matters to all of us. And Sean there calling, saying the responsibility should be put onto the shop owners and they should have security staff and everything else. I think we just got to get a bit real about this. People have got to take responsibility for their own actions. We shouldn't be expecting shopkeepers to employ more staff, spend more money when they're already up against the wall on trying to employ staff to get people to do
Roger,
what they're meant to do.
Do you know what some shopkeepers are telling me? You know, that Nolan radio show, it's a great conduit. And what they're telling me is they're fearful too. They feel abandoned, some of them. That if they're in a shop, they're often minimum wage people, and, you know, they've got to be there 8-10 hours a day with just this rolling the dice, this random roulette wheel of somebody walking in for their pint of milk or their bar chocolate, whatever it is, and some of them deciding, well, you know, we'll just throw our potential virus onto that shopkeeper. That's who I'm also fighting for tonight. Who's going to protect them? Because the police haven't done it so far.
Okay, Nolan. So you claim that you're wanting to protect the same people who you are causing the fear in by using fake numbers, ignoring the science that we will see in this video. If these same people stopped listening to the likes of you and the BBC using nonsense science, then they wouldn't be afraid to leave their homes. If these people turned off their TV and looked outside, they would see the actions of a pandemic, but funny enough, no pandemic. Just people like you rolling about harassing people at a local garage, causing fear.
Stormont hasn't done it so far. Not one fine issued in this country around face mask wearing. 1,700 parking fines issued, not by traffic wardens, by the police in a 12-month period.
It's very simple, Nolan. The reason why no fines are being handed out by the police is because it's unenforceable. Try ringing your doctor to get an exemption for wearing a mask, and they even tell you that they can't enforce it. Anyone who doesn't believe me, I challenge you to ring your doctor and get them to explain this so-called law.
I think we need to work out, how do we make this happen? How do we get it to stick? How do we get the general public to step up and do what they need to do? Because policing anything is always a matter of resources. There are thousands and thousands of shops in Northern Ireland. There aren't so many thousand police as there are shops.
Come on, I've heard this. I've heard this for many weeks, for many months now. But you know what? We don't say that about speeding enforcement. We just have the fear of being caught. We don't say that. The amount of stories...
Okay, people, so watch this. They're going to now start trying to compare not wearing a face mask to very serious crimes, such as drink driving, and Nolan even compares it to murder.
I've covered, and I would say this to the executive tonight, the amount of stories I have covered on the Nolan radio show where if someone drops a cigarette butt on the ground and there are wardens on the ground to find them, dogs doo-doo in the park, and there are people, we can find the resources to have wardens out doing that. And in the middle of a pandemic, we don't seem to be able to.
These dicks are looking for marshals and wardens to actually dander about and hand people fines for something that has been based on fake numbers and statistics.
I want to show you a graphic here. It's from the FT, and it just shows you how bad, the Financial Times, it shows you how bad some of our numbers are.
What are you lying for? Let's actually take a look at this graph. So according to this graph, Northern Ireland has the most rise in cases in comparison to these other countries. First thing that is wrong with this graph is that Northern Ireland is part of the UK. How are we meant to even trust these numbers when Carrie Mullis even said that the test should not be used to diagnose infectious disease? Sure, where are these models coming from? If you ask me, I'm calling bullshit in this graph, and Nolan, you're exactly right, rising cases, not deaths.
In Northern Ireland. Now you see that red spike, this is comparing it to other countries in the world, and in terms of our confirmed cases, look at that graph. We are worse than Spain, than France, than the rest of the UK, the rest of the United States. So don't give me this establishment crap. Tell me what you are going to do about it.
We all know what you're going to do, Nolan. You're going to stand at a local garage with a camera crew harassing people about masks.
Tell me what you are going to do for your community, on the Shankill, on the Falls, in rural areas. If you're part of GAA, if you're part of local soccer, if you're part of this organisation, if you're in the retail sector, what are you going to do when you see that graph? Dr. Chris Smith, can you tell us what on earth is going on in Northern Ireland? That we are spiking in our rates per 100,000, worse than anywhere else in most cases in the world. What are we doing differently?
Well, the nature of the beast is this is a really infectious agent, this virus. And the more cases you get, the faster you get the next batch of cases, because this is what's called an exponential growth. So if you already have a large, high number of cases in the starting point, you will get your next bunch of cases much more quickly. And that's why acting decisively and early really helps, because you nip it in the bud. It's run away, it's become large. This is why you need to intervene decisively at this stage.
The Health Minister, Chris, has told us in that interview tonight that in 2 weeks' time, if we continue on that trajectory, we're going to run out of capacity in our hospital, the spare capacity in our beds. Could it really eat up NHS resources that quickly?
Yes, it can, because, for example, in the hospital in which I work, we're already under very serious bed pressure. In fact, we're into negative bed territory. There are people on trolleys because we can't get beds for them, and we haven't even gone into winter yet. Why is that? Because in order to have physical distancing in the hospital to keep people safe, in the same way as we're advocating physical distancing out in public, we've had to space out the patients a lot more. And this means hospitals are already starting from a position of a disadvantage because they have fewer beds to start with. And as winter pressures are added, and then the impact of the coronavirus on top, it's intensifying an already tense situation. And that's why they're saying that they're potentially in jeopardy in a few weeks' time.
I don't necessarily believe this guy, and without a hospital name to check to see if they actually are overwhelmed, I'm going to take what he says with a pinch of salt. There's also very few hospitals in Northern Ireland, and if hospitals are overwhelmed, this could be easily checked by reports saying that the hospitals are not busy at all. Anyone in Northern Ireland can check these for themselves. Go to your nearest hospital and see for yourself.
You know, Alton Power, Professor Alton Power, 586 people dead in this country from COVID. There was
Stephen, you're wrong again. Not from COVID, with COVID. Don't be making it out as if 582 people died from something they didn't. They most likely were majority over 65 and had underlying health issues. It's the health issues that killed them. They just happened to test positive with a fake PCR test. That has been confirmed by the very man that invented it, that it doesn't and shouldn't be used to test and diagnose for infectious disease.
A death registered today. What about those people who come off with this stuff that this is no more deadly than the flu and we're overreacting?
It's many-fold more deadly than the flu. There's even, the worst flu that we've had in quite a long time was 2017, 2018, which was particularly bad. This particular virus is far more lethal than even that strain of virus.
Do you see if this guy here was telling the truth about the coronavirus numbers and understood the difference between deaths and new cases, then his numbers would be more accurate. I'll explain further in a minute.
And part of the problem is that it's a brand new virus. We're only getting to know it. There's only less than 10% of the population that have been infected with it so far. So there's still a huge amount of individuals that are still susceptible to infection. And one of the issues, this is where the virus has been so smart, if you want to put it in those terms.
It's a sneaky wee virus, sure. If you're eating a sandwich, it knows to avoid you because you're having your lunch, sure. It knows not to go to the bar until after 10. But it'll laze around your house all day, and they're going to be asking you to wear a face mask at home soon. Come on.
It only causes very severe disease in a particular demographic. Lots of other people walk around the place with no symptoms whatsoever. So how do you pick those up? How do you know whether they're actually carrying the virus or not?
Asymptomatic. That is a fucking cracker. Let's just take a moment to appreciate how much sense it makes. You might have it, but no symptoms. But oh no, you might pass it on to someone else. It's a catch-22 if I've ever seen one. Seems to cover every angle, doesn't it?
And this is where the intelligence of the virus comes in, is that it's capable of spreading left, right and centre with no control. And the problem is then, when so many people become infected, the actual case fatality rate might be relatively low for the virus, say compared to SARS-1, which was much, much higher, was 10%, or MERS, which is a cousin of SARS-CoV-2, which caused about 35% mortality. But because this spreads so easily and so fast, the actual numbers then are huge compared to what happened with SARS-CoV and MERS.
Whoa, wait, hang on a sec. A minute ago you just told us that hairdressers were working on clients whilst wearing a face mask, and their clients were fine. But now you're saying that it spreads so easily and fast that it has such huge numbers. Make up your mind. You can't tell us one thing and say another. Again, bullshit.
And therefore the absolute numbers that are dying and that are seriously affected by this virus are much, much greater.
Do you really think hundreds of people, or is this an exaggeration, could die this winter in Northern Ireland from COVID?
Very much so. If people don't take this seriously, very much so, yes. We see what's happening in...
People have been taking this seriously. 90% of people have been complying with the new rules, apparently. Everywhere I go, I see most people wearing masks. People have even took it as far to wear them in their own car, even when they're by themselves. And they call us the COVIDiots.
Brazil, we see what's happening in the USA, we see what's happening in other countries that are not taking it as perhaps as seriously as it should be taken. So yes, the consequences are potentially very, very grave.
We've got Rob on the line, 030 30 80 55 55. There's the number coming up on your screen. Evening to you, Rob.
Good evening to you, Stephen. I think the first thing for me to say is that my thoughts and prayers are with all those families who have sadly lost loved ones as a result of COVID-19, and those families who find themselves in the circumstances where their loved ones are currently in intensive care. I think it's important for me to state from the outset, Stephen, that I'm a mask wearer and I'm a mask supporter. But I do have to criticise you, Stephen, sadly, in terms of your interlude tonight, when you showed members of the public, you chased them about a car park of a garage, and I thought that was cringeworthy somewhat. I didn't think it was befitting, and I thought somewhat it fell beneath you. When we see political figures, people like Sammy Wilson, we've seen BBC editorial guidelines chase people previously. We've seen them doorstep people, and that hasn't happened. But you're chasing private citizens across a car park. Now, I'm disappointed.
Well, let me first.
Okay, this guy here, I have to agree with. Okay, fair enough. This guy wants to wear a mask, which is fine by me. Everyone has the right to do that if they choose, and at least this guy sees the sense that you can't just go to a garage and run around harassing people that you have no idea of their personal situation. If anything, all you're doing is causing fear.
Well, let me say this to you, mate. Right?
Sure.
First of all, your contribution tonight is necessary. Absolutely challenge me for what I'm doing. Okay, but I wonder, would you have the same attitude towards me if I was confronting someone who had been drink driving and had got into a car and had killed a couple of people on the motorway?
How can you compare a drunk driver to someone who is not wearing a mask? Keep in mind the numbers are fake, which we will prove in this video. I agree that drunk driving is dangerous and should be upheld by the law, but not wearing a mask is nowhere near the same comparison. Wise up, Nolan, you idiot. This is fear-mongering at its finest.
I wonder if you would be challenging me in the same way if I was confronting someone who had got into a car, looked at their mobile phone, was completely reckless, or got high on drugs and killed a couple of kids. And I just want to finish this and then I'll listen to you, right?
Did you hear that? Kid killer? Now, not wearing a mask makes you a kid killer? Come on, Nolan, you're getting worse now. All you're doing is making it easy to prove you're fear-mongering for the establishment. What was that you were saying about not working for the establishment? Paid by the BBC? Pushing the same narrative? Pushing the same fake numbers, deaths and cases?
Go ahead.
None of us know whether we have COVID or not, because you can be asymptomatic.
Yeah.
And I am asking those questions of those people who I confronted at that petrol station on behalf of elderly people who are terrified to leave their homes.
Because of people like you and the BBC, they sit at home and listen to your show, and fear is the result out of that. The media is the virus.
Because we do not have a safe environment as much as we can for them. I'm asking it on behalf of young people who feel invincible, and Professor Ian Young said today they might have long-term illness even if they survive this. I'm asking those questions on behalf of care homes, where there are elderly people towards end of life. If this gets into a care home, they could be in trouble. And I defend me asking those questions.
Well, and that's your prerogative, and that's your right to do so, Stephen. But here's what I say to you. I say that people have gone through a very, very difficult time, and I absolutely agree with the Nolan executive. I think that everybody should be wearing face masks where they can do so.
So why don't they?
But here's my point to you, and here's the question I want to ask you, Stephen, is how do you separate those who have a medical condition, who cannot wear a face mask,
really easy,
between those who don't have it?
Really easy. Really easy.
Really?
Really easy. Here's how to do
Tell
it.
me.
And listen, you're treating me with respect tonight. I think you're articulate. I'm trying to do the same back, right?
Sure.
We asked them. The first thing we did was ask every one of those people up there, can I ask, please, why you're not wearing a mask? Anybody who told me, whether I believed them or not, and I did believe them, anybody who told me, look, I've got a medical condition, I said, no problem, thank you very much. You're asthmatic, are you? And you think it's funny, do you? Do people dying? Is that funny? You know?
Really, Nolan? Because that's not what we witnessed when you chased this asthmatic guy, who clearly informed you he was asthmatic as you continued to harass the poor guy. And I quote, "Do you think this is funny?" Ultimately, Stephen, you have no right to even ask people why they're not wearing a mask. This could potentially put vulnerable or disabled people under duress or stress. Do you ever think of that before your dramatic escapades prancing across the garage forecourt, harassing this guy with an asthmatic condition? You should be ashamed of yourself. How would you feel if someone chased you across the local garage fat shaming you? You do realise that obese people also put strain on the NHS, and that number is a proven fact, unlike yours. So continue on with that fat paycheck from the BBC and get yourself another pie.
What I was confronted by was people saying, well, it's in my pocket, but it didn't cross my mind.
But
Or
here's
I'm
the
not doing
thing,
it.
Stephen,
Or people or people laughing at me. And I'll tell you what, there's nothing funny about this.
Notice how this guy actually put together an intelligible and well-spoken argument and had the common decency to let Nolan talk. And as you can see, Nolan did not return the courtesy and did his usual shut down bullshit.
I want to say thank you. Anne and Kelly Legs next. Hello, Anne.
Hello, Stephen. Stephen, I just want to say that I have a severely autistic son. He is in residential care. During the last lockdown, which I totally agreed with, we didn't get in to see him. We couldn't go in. So, and I agreed with that wholeheartedly to keep him safe. But I didn't get to see him on his birthday. I didn't get to see him at Easter. I couldn't even let him see me through a window because he can't understand why Mummy can't come in. So I had to stand at the top of the driveway, out of view, set his presents and his Easter egg on the pavement. A member of staff came up and took it in.
I feel for this woman. I really do. She's allowing herself and her family to live in fear because of people like Nolan. The government has put fear into this lady so much that she's willing to let her son suffer with no evidence that either of them were affected.
Now, if people continue to flout the guidelines the way they are, not wearing masks, mixing with whoever they like, I could be facing that again at Christmas. I could be standing at the top of a driveway without even getting a glimpse of my son while staff left presence of a pavement. And I'll challenge anybody to follow me in if they want to, if it comes to that on Christmas morning, and watch me turn away from there in tears and then come home and sit down with their family and eat their Christmas dinner.
So how do you feel? That's heartbreaking. How do you feel about those in our community who are not doing this simple thing of keeping a couple of metres apart and putting a bit of cloth over their face? How do you feel about that?
To be honest, I think they are totally selfish and self-centred. They just don't care. And for some of them, I honestly think it's just a matter of, because Stormont have told them to do it, they won't do it. They're just being thrown for the sake of a Northern Ireland word. They're being thrown. They won't let anybody tell them what to do. But for the sake of me, and people, and I also work in a care home, so I mean, we have people with dementia who can't see their family, and it's heartbreaking.
I hear you. Listen, thank you. Andre Walker, broadcaster, commentator with us tonight. You're against people being forced to wear a face mask. Tell us why.
Well, I think this is the guy I want you all to see. This guy puts Nolan into a position that he has no other choice but to hear some facts about how the case and the deaths are recorded. I'm going to let this guy speak, so pay close attention to what he has to say.
It's first of all incredibly important to understand this figure of 586. So essentially, it's not that people have died of coronavirus, 586 of them, but rather it's people who've died with coronavirus. Now, let me give you the definition of that. If you tested positive for the coronavirus within the past 28 days, then you are counted if you die as having died of the coronavirus. Now, let me be clear. If you tested positive, Stephen, for coronavirus today and then recovered and in 28 days' time jumped out of a plane without a parachute, you would be classified as having died of coronavirus.
Open Power, is that true?
Completely ludicrous. I think the point that we make...
Hold on a minute. Is that true?
So I think he's making a fairly ridiculous argument.
Ridiculous? Ridiculous nothing. This guy's making perfectly valid and correct points. Nolan himself confirms it is a valid point, and the only person that is ridiculous is the so-called expert.
In the sense that there are the vast majority of people, yes, they do die with a positive coronavirus or COVID-19 testing done. But what he's ignoring is the fact that people with very severe disease, the coronavirus infection will precipitate the demise of that person. And this is the really important point.
Hold on.
Important point is that the infection, those people would not die if they didn't have the coronavirus. So yes, they are very ill people, they have comorbidities, but a large...
So if you die in a car crash, how did COVID contribute to that death?
Proportion of them will die because the coronavirus sets in motion.
Stephen.
Okay, go on, Andre.
Can I ask this? And I've got an echo in my ear, so apologies. But is it true that if I tested positive for coronavirus today, in 28 days' time was run over, I would be added to the list of people who had died of coronavirus? And I make that point very simply because of this. Every year, 1.5 million people die of poverty.
Dr. Chris Smith, did you pick this up? Is he right?
Sorry, there were two people talking. What is he right on?
Is he right? Andre Walker is essentially saying that, for example, if you're tested positive with coronavirus now, and in 28 days' time, if you got run over by a car, you would be among the figures of people who died because of COVID. Is he right?
Yeah, that's how the data are currently being logged. That is correct.
And there we go. Did you hear that, people? Did you actually hear that? If you test positive and die up to 28 days later of any other cause, then you're counted as a COVID death. Therefore, you can see clear evidence from a scientist's mouth that the numbers of cases and deaths are wrong and are being used by Nolan to cause fear. What I now want you to look out for is how Nolan ignores the information, despite everything he has said where he promises he will listen to the scientists.
So if you receive a positive diagnosis and then you die within a 28-day period of receiving that positive diagnosis, regardless of what you die of or with, you will be logged as a COVID death.
Again, just to highlight, regardless of what you die of or with, you will be logged as a COVID death.
So in other words, there
Stephen,
will be
how many
cases.
people...
There will be cases in there of people who are actually logged as COVID deaths who are not COVID deaths. They will have recovered from coronavirus infection and died of something else. But equally, we probably are missing some diagnoses as well. People who don't ever receive a COVID test, they just are passing away and that diagnosis is being missed.
Stephen, can I
so
make this
therefore,
point?
the two probably balance each other out.
No, Andre, I think you've been...
So there we have it, everyone. How can these people use these numbers to warrant a pandemic? If you can't see it when it's right in front of you, I'm not sure what evidence can be shown that can prove the numbers are false. Therefore, they can't base their facts on this. It's just ludicrous. But anyway, let's get back to Nolan dodging the science.
A valid point tonight, right? But are you disputing how deadly coronavirus is? Just for the record, are you disputing how deadly it is?
Sorry, Nolan. Are you in the same conversation? He didn't dispute or deny how deadly the coronavirus was. He is disputing the numbers that you're basing your harassment on. But you know that, and that's why you're trying to ignore the science here.
Well, in my category, I have a 99.998 survival rate. But let me finish the point on the economics. In 2008, the financial crisis cost 1 million lives, according to Oxfam. That was a 2% monthly decline in GDP. We have had a 20% monthly decline in GDP, willfully inflicted upon us by a government. People will die as a result of this. There is no point in saying you can destroy the economy of Northern Ireland and it has no cost whatsoever. And therefore, first of all, they don't know that 586 people in Northern Ireland died of coronavirus. That figure is simply nonsense. But how many people in Northern Ireland will take their own lives having lost business? How many people will have their nutrition negatively affected? How many people's housing will become less good?
I'll tell you what, Andre.
Notice again how Nolan just completely ignored the question and jumped to the words balance. He even had a cheek to accuse the caller of trying to shut him down when Nolan is the only one shutting down here. and he's just looking over the point that he made the COVID deaths are counted wrongly. But will Nolan admit this? Let's carry on.
So it's a balance, isn't it? To be fair to the Northern Ireland Executive, they've been saying that they're trying to have this balancing act of keeping people as safe as possible and keeping as much of the economy open as possible. And how can they do that? What might actually result in fewer restrictions in this country? If we bloody well follow the restrictions we've got now.
No.
They might not need to lock this country down. No, don't shout me down, mate, and then you can come in. Stop. They might need to actually not need to lock this country down if all of us took that self-responsibility of trying to stay apart, of trying to wear a face mask, of trying to wash our hands. It's just logical, isn't it? That they might not need to lock us down if we all followed that. So for businesses being put out of business, some of that might be down to these people who don't give a damn. You watch these people walk into shops, they could be closing you down. They could be doing it.
Where is the responsibility of cancelling 1 million breast cancer screening sessions? Where is the responsibility of delaying 50,000 cancer treatments? Where is the responsibility of leaving 50% of hospital capacity basically empty, waiting for coronavirus patients who are not going to be there? The Nightingale Hospital, what was it, 5,000 beds, 17 patients. We are destroying our economy on science that is simply nonsense.
Case closed. This guy is absolutely correct. It was confirmed also by the other scientist. This is nonsense science, and we are closing our economy over it. And Nolan here is helping spread the fear.
I just wonder if you saw what happened in Italy, and would it not be irresponsible for us to have followed suit? Ulton, do you want to address this point?
Nobody is ignoring the economy. Nobody will say that it's not having an impact in other parts of the NHS and other parts of treatments. I mean, that's ridiculous to even think that that's the case. We have an immediate crisis where the death rate associated with it, and not only that, but the hospitalisation. You've heard Chris saying that they're already towards the brink of disaster in terms of the amount of people that they have in their facility. If that increases substantially, we get to a stage where we're not able to cope with the number of patients that are there. And if that happens, then the disaster happens soon afterwards.
Dr. Chris Smith, I'm hearing from sources within the executive that they have not decided this yet, but within the Northern Ireland Executive, I'm hearing that they are actively considering a 2 to 3 week lockdown at Halloween, because that's when the children will be off school as well. It has not been decided yet, but they're actively considering it.
From the time this video was recorded, the schools have indeed been closed and the madness continues.
Is what sources are telling me. What effect would that have on infection rates and ultimately hospital admission rates? Do you think it's a good idea?
Personally, my instinct, and I haven't looked at the precise numbers, but my instinct, based on my understanding of how this might be implemented and the trajectory of the response across the country to the more formal lockdown, is that this wouldn't be that effective. And I think that for several reasons. Foremost among them is if you look at the incubation period for the disease, it's quite long. And that's one of the reasons why it's been quite tricky to get a handle on it and control it. It's got an up to 14-day incubation period. So in other words, if you had people who got locked down for this contact breaker or circuit breaker, whatever we want to call it, period, and there were people who are infected at the time that you embark on it.
Not only has this expert scientist, whatever you want to call him, doctor maybe, has confirmed that no matter what you have died of after a positive test within 28 days, he has now just said that the circuit breaker is no good.
They'll have infected all the members of their household. They might then take 2 weeks to incubate it, and then they emerge from the lockdown, the mini lockdown, and they then manifest it. Now, I'm taking an extreme example, but you can see the point that we know that 70 to 90% of the...
Here we go again, more fear-mongering. It's in the household. What are these people expecting that we do? Next, they'll be trying to take us out of our own homes to contain the virus.
Transmissions actually occur in the domestic setting. So locking people up in the very place where transmissions are already occurring is probably not going to break the back of this. It's probably going to be a higher price than than actually we derive in terms of benefit from doing it. And the way in which you intervene with this is you say, well, where are all the transmissions occurring? Yes, they're happening in the domestic setting. What can we do about that? Well, we have to intervene in that regard. Perhaps it's a question of minimizing transmissions within the house. How do we do that? Very, very difficult. So this is why it's proven so hard to get a grip on this. That and the point that was made earlier, which
2/3 of people will not display symptoms. Then why are we locked down? Notice how their own information doesn't even line up with their own narrative. Anyway, let's wrap up this video.
which is that 2/3 of cases of this display no symptoms whatsoever. And if you have a disease with very few symptoms, it's like having the perfect cloaking device. It's invisible. You can't spot it. Very hard to control it.
Okay. Chris, thank you very much indeed. Alton, thank you for what you do for us. And, you know, you're often on the Nolan radio show and Nolan Live, and I'm really appreciative, sir. All right?
Very welcome.
Thank you very much indeed. And thank you to Andre and to Dr. Chris tonight. We're going to pick this up on Nolan Radio tomorrow morning at 9 a.m. on BBC Radio Ulster. Let's move on.
If you've managed to stick the video this long, I want to thank you. Please make sure you subscribe, comment and like this video and get it out to everybody that you know. More content to come soon.